Secondary causes of hypertension. So under the heading of renal parenchymal disease, this can include the elevated clinical features includes the elevated serum creatinine. Next, it can also include the abnormal urine analysis such as the proteinuria and the RBC cast. Next, the renovascular diseases. This can include the symptoms severe hypertension, often greater than 180 mmHg, systolic, and diastolic being around 120 mmHg, and this is mainly seen after 55 years. There is also noted possible recurrent flash pulmonary edema, flash pulmonary edema, or resistant heart failure. There is also presence of unexplained rise in serum creatinine, and in case it also shows abdominal bruit. Now looking at the other conditions, that is primary aldosteronism. It presents with the easily provoked hypokalemia, also shows slight hypernatremia and hypertension with adrenal incidentaloma. Next, looking at pheochromocytoma. It has the paroxysmal elevated BP with tachycardia and pounding headaches and palpitation, as well as diaphoresis. It also has hypertension with adrenal incidentaloma. Cushing syndrome. It can present with the central obesity and facial plethora. The proximal muscle weakness is seen, and there is abdominal stray. Ecchymosis is seen, and amenorrhea, as well as erectile dysfunction. There is hypertension with adrenal incidentaloma. Hypothyroidism. Here there is presence of fatigue, dry skin, and cold intolerance. There is also presence of constipation, weight gain, and bradycardia. The primary hyperparathyroidism features include the hypercalcemia, that is polyuria and polydipsia. There can also be presence of the kidney stones, and there can be neuropsychiatric presentation such as normally confusion, depression, and psychosis. Next, looking at the coarctation of aorta, it shows by the differential hypertension with brachial femoral pulse delay.